Let's dive into something that's absolutely central to your healthcare journey, but, it's often kind of misunderstood. We're talking about informed consent, and I promise you, it's so much more than just a quick signature on a form. It's really about your rights, your voice, and your power to make decisions about your own body.
So, let me start with a tough question, but it's a really important one. Imagine a doctor recommends a treatment that could literally save your life. Do you still have the right to say no? The answer to that question? Well, it gets right to the very heart of patient rights, and it's exactly what we're going to unpack today.
To really get to the bottom of that question, we have to start with the foundational idea here, a patient's absolute right to choose. To really get this, we've got to look at two ideas that are basically the cornerstones of modern medical ethics. On one side, you have patient autonomy. Think of this as the core principle, your fundamental right to decide. And on the other side, you have informed consent. That's the actual process that makes that right a reality.
Okay, so first up, patient autonomy. This is the big, powerful idea that you are the ultimate authority over your own body. It's all about respecting you as an individual, with your own values, your own beliefs, and your own goals for your life.
So how do we actually put that big idea of autonomy into action? Well, that's where informed consent comes in. And it's not a single moment, it's a whole process. It's the conversation, the back and forth that allows you to use your autonomy and ensures that any decision you make is truly yours. But, these rights weren't always a given. They were actually hard-won in the courtroom. Let's look at a couple of huge cases. All the way back in 1914, the Schlondorf case established something that was revolutionary at the time, that operating on someone without their consent was basically a form of assault. Then, almost 60 years later, Canterbury v. Spence really cemented this, ruling that doctors have a clear duty to tell you everything you need to know, all the risks included.
In that 1914 case, it gave us one of the most powerful, clear-cut statements on patient rights ever written. I mean, look at this. It just lays it all out right there. It's your body, it's your decision, period.
So we've established that you have this fundamental right to decide. But what actually makes your yes or your no a valid one, both legally and ethically? Let's break down the key elements of what makes consent, well, true consent.
For consent to be genuinely informed, it has to be built on these 4 pillars. And here's the thing. If even one of them is shaky, the whole structure of valid consent can just come crashing down. Let's quickly walk through that. First, disclosure. Your doctor has to tell you everything, the good, the bad, the alternatives. Second, comprehension. You have to actually get what you've just been told. Third, voluntariness. This choice has to be yours, free from any pressure. And finally, competence. You have to have the mental capacity to make the decision in the first place. The key takeaway? All 4 of these have to be there. This is not a best 3 out of 4 kind of deal.
Okay, this brings us to a really important shift in how we think about this. Informed consent is not about the piece of paper you sign. It's all about the conversation you have.
Nowadays, the gold standard is something called shared decision-making. This isn't your doctor just telling you what's going to happen. No way. It's a true partnership. They bring their medical knowledge, and you bring your life experience, your values, what matters to you. And together, you figure out the best path forward. But of course, the real world is messy. It's rarely that straightforward. So let's explore some of those gray areas, the really tricky situations where the clear lines of consent can start to get a little bit blurry. So here's a classic example. An unconscious patient is brought into the ER. There's no family around, no time to ask questions. What happens then? In these urgent life-or-death moments, the law works on this idea of implied consent. It's basically a common-sense assumption that any reasonable person would want the doctors to do whatever is necessary to save their life. The top priority shifts to just doing what's in the patient's best interest. Okay, what about when the patient is, say, a teenager? A 16-year-old can have really strong opinions about their care, but legally, their parents are usually the ones making the final call. So, how does that balance actually work? It's a real balancing act. While the parents provide the legal consent, the medical world is putting more and more importance on getting the minor's assent, which is basically their willing agreement to go along with the plan. And on top of that, there's the mature minor doctrine, which recognizes that some teens are absolutely capable of understanding and making their own informed decisions. Now we're getting into a really personal and sensitive topic. What happens when someone's core beliefs, maybe for religious reasons, are in direct conflict with a doctor's recommendation? Think about refusing a life-saving blood transfusion.
How is a doctor supposed to handle that?
Well, the ethical duty here is crystal clear. The provider must respect the patient's autonomy. Their job isn't to judge the belief, it's to make 100% sure the patient fully understands the medical consequences of their choice. It's all about respecting those deeply held beliefs while still doing their job to inform.
All right, we've talked about the principles, we've gone through some of the thorny problems. Now let's get to the most important part. How you can step up, take an active role, and make sure your voice is heard in your own care. Here are some incredibly powerful things you can do. Never, ever be afraid to ask questions. A great one is, what are my other options? Or even, what happens if we just do nothing for a bit? You can also try the teach-back method. Just explain the plan back to your doctor in your own words. It's a great way to make sure you're both on the same page. And honestly, don't underestimate bringing a friend or family member. A second set of ears can make a world of difference.
And that really brings us right back to the main idea. The entire system is moving towards making you a partner in your own healthcare, not just someone things happen to. It's all about being an active, engaged member of your own team. So the only real question left is, are you ready to step up and play that role?